Hello everyone, my name is Amrit and today I will be presenting my summer research project about COVID-19 information-seeking behavior in the elderly Punjabi immigrant community in the Greater Toronto Area. This project was supervised by Dr. Tanvir Chaudhary. Health information-seeking behavior is the purposeful seeking, finding, and retrieving of health information. This affects levels of health literacy within the population and has influences on healthy behavior choices and access to healthcare services. This ultimately impacts health and well-being. This is particularly relevant during the COVID-19 pandemic. Information seeking has implications for vaccine uptake rates, adherence to public health guidelines, and also has social and economic consequences because of individual level behaviors. However, it can be difficult to be informed during the pandemic because of misinformation. Certain populations may be particularly susceptible to misinformation and disinformation during the pandemic. That is why I chose to focus my project on elderly Punjabi immigrants. Immigrants in general make up 21.5% of the Canadian population, and over 300,000 arrive to Canada annually. However, these immigrants are also more likely to experience barriers such as transportation, language, and social barriers that contribute to health disparities. The objective of this study was to understand elderly Punjabi immigrants' COVID-19 vaccine-related information-seeking behavior in the GTA. As for the methodology, I used a unique community engagement approach by collaborating with immigrant senior groups. This helped to empower immigrant communities to become involved in their health on a greater level and also increase their understanding of health. I surveyed 341 elderly Punjabi immigrants in the GTA. 64% were male, 36% female, 84% were retired, and 57% had less than a high school level of education. The mean age was 68 years. The survey included need for COVID-19 vaccine-related information, barriers to information, the type of information sought, sources of information, and information-seeking habits. There were two main findings. Firstly, there is a concerning lack of information seeking overall. In fact, 47% of participants never sought COVID-19 vaccine-related information. Secondly, information seeking varied with age and education. Within participants who never sought COVID-19 vaccine information, 86% had less than a bachelor's degree. 74% were older than 65 years of age. The reason why 47% of participants never sought information is primarily due to an accessibility barrier. This includes transportation, language, and technology barriers that hinder access to information. However, even among participants who did seek COVID-19 information, frequently 38% experienced a language barrier, 21% experienced a technology barrier, and 14% experienced fake news. The top COVID-19 source used was the TV, followed by interpersonal communication, the radio, general internet searches, and social networking sites. Sources were used because of their practicality and out of habit as opposed to reliability. Furthermore, participants greater than 65 years of age were less likely to use reliable government sources and more likely to use sources like the TV, radio, or newspaper. Similarly, participants with less than a bachelor's degree were also less likely to use reliable government sources and more likely to use practical sources such as the TV, newspaper, and interpersonal communication. These results lead to the conclusion that most immigrants are not able to access COVID-19 vaccine information or have difficulties doing so. Information seeking frequency and sources used varied with age and education. Thirdly, participants preferred sources that were practical and used out of habit, as opposed to reliable. There are significant implications of this research for the future of health promotion and information communication. Firstly, this research highlighted the need to address technology and language barriers within the 65 plus and low education immigrant demographic. This requires interdisciplinary collaboration from policymakers. For example, government initiatives to host technology literacy workshops and provide universal access to internet can increase accessibility for immigrants. Secondly, this research highlighted most commonly used sources. Through interdisciplinary collaboration, key players in communication industries can introduce reliable programs and become key sources of information on these identified platforms. And also, future research directions for this project include gaining a more detailed understanding of barriers experienced by immigrants in accessing information through a qualitative interview study, which could further inform policy and program level interventions. These are my references. Thank you for listening.